Come in.
Hello, my name is Anita Williams. I'm a nurse practitioner student with Excelsior College, and I will be doing your exam today.
Okay.
Okay, what is your name,
Amy Cook,
your date of birth,
6/26/79,
and how old are you?
44.
And can you tell me who the president is?
Biden.
Okay, before we get started, I'm going to wash my hands and then do a quick review.
Okay.
And while I'm washing my hands, if I had watched her get up and walk, it would have been, I would have been assessing her mobility.
No.
Okay, so now I'm just going to take a quick look at you. Take a look at your skin. Yeah, skin is warm, dry, without any lesions. She does have a spot on her left knee. Is it giving you any pain?
No.
Okay. All right. And then I'm going to check your hair.
Okay.
Feel, make sure there's no lumps, no bumps. Is it sore or hurting anywhere? Okay. So Mrs. Cook appears to be alert and oriented ×4. She does not appear to be in any pain. And vital signs. We had already did her vitals before we came in. All of her vitals were good. Blood pressure was 118/64 with a pulse of 20, heart rate of 72, and your temperature was 97.9. Height and weight was all good. Your height is 5'2", with your weight was 124, I believe, 124. And I think your BMI was like 24.9, but everything was all good. We also did her visual acuity with no lenses or glasses or anything. 22 vision, okay? 2020 vision, sorry. 2020 vision. Okay, now can you put your head down for me? Raise your head up. Turn your head to the side, over to the other side. Okay, turn it back around and try to go to the side, other side. Okay, good. So now I'm just going to be checking your sinuses, making sure everything is good. Tell me if it hurts. All right. Excellent. Does it hurt?
No.
Okay. All right. So let's see. I'm going to check some sensations, seeing how you feel.
Okay.
And then I'll have you to close your eyes. You can tell me if you feel soft or either if it's
Okay.
short. Okay?
Soft. 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 Sharp. 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 Sharp.
Okay. All right. So next, let's check your for TMJ. So I'll have you to clench down on your teeth. Okay. No popping or locking. Good. And now we're going to check some cranial nerves. Can you frown for me? Okay. Can you smile? Open your eyes. Can you raise your eyebrows? And then close your eyes one more time and see if you can open them. Okay. Does that hurt?
No.
Okay. All right. So now I'm going to look in your mouth and see how everything looks. Okay. Can you say teeth are good, white. You can open them. Okay. Does that hurt?
No.
Okay. All right. So now I'm going to look in your mouth and see how everything looks. Okay. Can you say teeth are good, white. Okay. And let me say it one more time. Just say for me. No gag reflex. Okay. All right, and while I have my light, I'm gonna check your nose. Are you having any problems with your nose?
No.
Okay, nasal mucosa is pink without any drainage, no polyps, bumps, lumps. Okay, I'll have you to cover up one nostril and take a deep breath. Okay, do the other. In, good. All right. Septum is good, intact, no deviations. Okay, now let's take a look at your ears. At this point, we will be doing, we would have a tuning fork, or we would put the tuning fork behind the ear. I would hit it, and y'all would put it behind your ear, and you will wait, and whenever you stop hearing it, it's when you would raise your hand, and we would do that bilaterally. But we don't have a tuning fork here today. It was misplaced, but that's what we would do. But now I'm just going to take a look at the external ear, making sure, is your ear hurting or
No.
okay? This ear?
Good.
Okay, and then I'm going to look inside the ear. Ear is good, pink, no redness, swelling, tympanic membrane intact and can be seen gray, which is normal. Here, no swelling or irritation. Tympanic membrane is great and normal. And now we will be checking to see if you can hear well. So I would like for you to repeat what you hear.
99. 99.
Okay, hearing seems well. Okay, let's see. Let's check for your thyroid. Okay, I'm gonna stand behind you
Okay.
and have you to swallow. Let's see. Thyroid palpate, and you go ahead and swallow. Okay, seems to appear normal, no lumps or irritations. We want to palpate your lymph nodes, the occipital, the ocular, periocular, postocular, submaxillary, submental, the cervical, and also the supraclavicular lymph nodes. And they all appear normal. Well, next, I just want to take a look at your heart, or not take a look at your heart, listen to your heart, take a look at your spine. First, let's check your shoulders. If you can shrug your shoulders up and then down. Okay, and then can you do it again? Up and down. Okay, any pain?
No.
Okay, all right. I'm going to ask you to remove the top of your gown. And then I'm just going to take a look at your skin, noting she does have a tattoo to, is that the left side? Right side. And then I'm just gonna,
No, that's my left. You're right.
you
I don't know what side I'm on.
I'm just gonna feel around, making sure that you don't have any discomfort, any
No.
at all. All right, and then if I can pull it down just a little
Sure.
further. All right, I'm going to ask you to take a deep breath in and out. Okay, one more time. In and out. AP diameter is good. And then I'm going to do it from the back as well. If you can take a deep breath in and out. Okay, good. And now I'm going to take a listen to your heart and breath sounds as well. And when I place this on you, you can take a deep breath in and out. And then I just want to listen. Okay, I'm also going to take a listen up here, making sure there's no groups. Okay. All right. At this point, I would inspect the breast, but we are deferring that. But if so, we'll recheck for any bumps, bruises, masses, lumps, drainage, swelling, any abnormalities. And it does not appear to be any abnormalities in that. So next, I will have you, I'm going to listen to your lung sounds from the back. Okay. All right. Now, let me go ahead and have you lie down. Okay, before I have you lay down, I'm going to go ahead and percuss the back, and you can tell me if you feel any pain.
Okay. No. 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 No.
Okay. And if you feel any pain.
No. 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 No.
Okay, and then I'll have you to lie down. I want to check for your Babinski reflex, so I'm just going to like tickle on your feet. Okay, all right. Now can you take your fist, go up, go across, and out, and then keep your rolling back to the back. All right, range of motion is good. All right, now I'm going to take a listen to your stomach. Oh, first, let me just see, are you having any problems in your stomach?
No.
Just gonna check it, make sure there's no pain, no discomfort. I'm gonna go down a little further. Tell me if I've hurt you.
No, you're good.
Sorry. Okay. Yep. Now I'm gonna check to see your spleen placement and also your liver. See if I can. Liver is not palpated, which is normal. And I'll check for spleen. Any discomfort? Spleen is not palpated, which is normal. And then I'll check back here for kidneys. Does that hurt?
No.
Good. Good. Umbilical is good, midline. And then I'll listen for your bowel sounds. Bowel sounds are active, all quadrants. And then I'm going to pull your pants down for just a second. Checking for pulses, for inguinal. And both are positive. Okay, now I'm just going to check movement in your legs. If I can raise your leg up and you can tell me if it hurts or, okay. This one up, tell me if it hurts. Okay, so next, that was just checking the range of motion. Let's see, I'm sorry. Let's go ahead and check for your deep tendon reflexes. So, let's see, how about I have you raise back up? I'm sorry.
No problem.
Okay. This And I'm going to hold your arm out and just check to see if I can get some reflexes.
Okay.
Oh. Okay, let's check your wrist. Okay, and then I'll check your knee. And we would do it bilaterally, of course. Okay, and they're all, she has reflexes on all. And then I would check for your pulses in your feet. And that's good. That's good. And we would do it bilaterally, but for taping purposes, we'll only do one side. Let's see if I can have you stand up. And then if you can close your eyes, hold your hands out to your side and touch your nose. We're just checking for balance. Okay, and then take your left foot and sort of put it up and rub with your shin, and then do the other one. And then I'll have you walk on heel to toe or toe to heel. Okay, and then while you're standing, I'm going to check your spine, making sure the curvature is good. If you can bend over, and we'll. Does that hurt? Or...
No.
Okay, spine is good. Okay, and then if you want to have a seat back on the table, we're almost finished with your hand. Alternating movements is good. And last, I'm going to check your sensory, see if you can smell. I have to do it early. If you can cover one nostril, close your eyes, and take a sniff. And tell me what you smell.
Cinnamon.
Okay, and we'll do the other side. And what do you smell?
Cinnamon.
Okay, all right. Well, do you have any questions?
No, I think I'm good.
All right, thank you.
Thank you.
My comprehensive charting in regards to my exam would read as follow for the review of systems. The general appearance, she was alert and oriented ×3 and did not appear in any acute distress, and she was well nourished. The head was non-cephalic and atraumatic without tenderness, visible or palpable masses were noticed. Her hair was normal in texture and evenly distributed. Next, I moved on to her sinuses, which the nasal mucosa was pink and moist, and the nasal septum was at midline, and there were no deviations noted. Her nerves were patent bilateral. There was no drainage noted, neither no swelling, polyps, or sores. Then I moved on to the sensation and the awareness to her forehead, cheek, and jaw bilaterally with sharp and dull objects, and she was able to identify both the soft and the sharp. I was also able to palpate the temporal and the masseter muscle by pushing down on the mandible against resistance. She was able to clench her teeth without any difficulties. My patient was also able to raise her eyebrows, frown, smile, and open her eyes against resistance. So the cranial nerves 5 and 6 all were intact and within normal limits. Checking her mouth and the oral pharynx with the light. Her soft palate was pink, was not inflamed. There was no edema, sores, or drainage. I did test her gag reflex with a tongue blade. There were no gag reflex noted. Her tongue, she was able to move it around also without difficulty. So in other words, the oral mucosa was pink and moist with good dentation. Her tongue was normal in appearance without any lesions and with good symmetrical movement. There was no nodules or lesions noted, and there was no tonsilicular edema or swelling notated. Moving on to palpating her lymph nodes, they were all within normal limits. There was no irritation, no pain noted whatsoever. I was then able to inspect her outer ear, and there was no redness, no drainage, no abnormalities. Internal and external was all intact. The ear canal was clear to see. Her tympanic membrane was gray in color, which was normal bilateral. Her hearing intact also was well. She was able to pass the whisper test by repeating the 2 syllables words that were given to her. There was no tuning fork in use because it was misplaced, but in other words, I explained during the exam that the tuning fork was there so to ensure that her hearing was appropriate. If the tuning fork was available, I would have placed it and tapped it, making the ringing sound. I would have placed it behind the ear, and she would have made a notation of when she stopped hearing the sound. And then we would put the tuning fork in front to see if she still could hear the sound. Visual acuity test was done prior to the exam, which she used no corrective lenses, and her eyesight was 20/20. Her conjunctiva was clear, pink. There was no exudates, no hemorrhages, no drainage, no signs of nystagmus. Her eyelids were normal. Eyebrows, eyelashes were all intact. There was no swelling or lesions, and her eyes were performed by using the light, and I accessed her peripheral vision and checked pupillary light reflection, which were all within normal limits. Moving on to the next, my documentation would read as follows. Her neck was supple without any abnormalities. The trachea was midline. Her thyroid gland was normal without any masses. I listened to her carotid. The carotid pulse was positive ×2 or +2, bilateral without any roots. No JVD noted. Moving backwards, I did want to report also in my documentation regarding her eyes. When the eyes were inspected, I also assessed the 6 cardinal fields of gaze by using the H motion, which she was able to follow without difficulties. The peripheral vision would have been used. You could either cover up one eye and use decide, making sure that she was able to see her peripheral vision. Documentation for the thoracic and lungs. Her respirations were even and relaxed. Her chest expansion was symmetric. There was no retraction or bulging or interspaces. There was no pain or tenderness upon palpitation. The percussion tones did resonate over all lung fields. Vesicular breath sounds auscultated over lung fields. There was no abnormalities noted. I was able to palpate bilateral radial pulses along with her dorsalis pedis and the posterior tibial pulses. They were all intact and positive. There was a normal rise and fall. The AP diameter normal, no difficulties. She was able to shrug her shoulders with and without resistance. I did defer her breast exam, but if a breast exam was completed, I will look for color, drainage, any nodules, any masses, any pain or discomfort noted, any dimpling, any abnormalities noted with the breast. I would have documented. I was able to assess for any masses or tenderness upon palpitation, which there were none noted. My patient's abdomen, her skin on her abdomen, there was no scarring, no lesions or rashes. There was just a pinpoint, looks like a scratch noted on the left side of her abdomen. Her umbilicus was at midline, but there was no bulging. Her abdomen was flat and symmetric with no lumps or bulging. There was bowel sounds active in all quadrants. There was no coastal vertebral angle tenderness noted, neither. I was able to access for her liver and spleen, which they were not palpable. Her inguinal pulses were noted, but there was no pain or discomfort or difficulties noted. The patient was able to get up off the table, move herself off the table. Her gait was smooth. There was equal strides and good base of support. She had full range of motion of TMJ with no pain or tenderness, no clicking. Her joint midline, there was no swelling, no redness, normal curves. Her spine was without any abnormalities. She was able to move around without any difficulties. Mrs. Cook was able to move her shoulders and elbows with and without resistance. She performed a range of motion with her wrists and hands and fingers without any resistance as well. Her lower extremities, while she was laying on the table and upon ambulating, had no difficulties, no tenderness. DTRs were checked and they were all within normal limits. Her Babinski reflex, I only performed on the bottom of her left foot, which was reactive. I was able to inspect her back and the range of motion again. There was no scoliosis noted. Her balance was equal. She had excellent balance, was able to place her finger to nose with eyes closed, and there was no dizziness or lightheaded, no pain or discomfort noted. Sensory sensation, all intact, no difficulties noticed. Thank you very much for giving me the opportunity to complete my comprehensive head-to-toe exam. Thank you.